guys, it's Julia from YOLO with Katie and Julia, or Julia and Katie, I don't know how to put it, I don't remember right now, I'm too busy. But this is the second part of maybe 3 or 4 parts, I'm not sure. If you didn't see my last part, go check that out. It'll be on my channel. Actually, it is on my channel, but I'm continuing to read about my TS, or Tourette's syndrome, or just simply Tourette's. But today I think I'm going to read how is TS diagnosed, how is TS treated, which is a long one, and is TS inherited. I know I'm going to say right now, with my family, there's a bunch of people with Tourette's syndrome in my family. And I'm in the middle of being diagnosed with it. So, yeah. I think maybe the next... Yeah, this is going to be a 3-part series, because I can't read all of this. Okay. So, let's get into it. First I'm going to say is I have been noticing many of my symptoms since maybe this time last year, or a little bit before this time last year, so it makes sense. Okay. TS is diagnosed that doctors make after verifying the patient has both motor and vocal tics for at least 1 year. The existence of other neurological or I can't read that word. I think it's thoracic or something. That conditions could also help doctors arrive at the diagnosis. Common tics are often not misdiagnosed by knowledgeable clinicians. However, atypical systems or atypical presentations, for example, onset of symptoms in adulthood, may require special facility expertise for diagnosis. There are no blood laboratory or image tests needed for this diagnosis. In rare cases, neuroimagery studies such as magnetic MRI or a CT scan or EEG studies, or in certain blood tests, may be used to rule out the other conditions that might be confused with TS when the history or clinician examination is optical. Okay, I just turned off my tablet on accident. It's not uncommon for patients to obtain formal diagnosis of TS only after symptoms have been persistent for some time. The reasons for this are many. For families and physicians unfamiliar with TS, mild or even moderate tic symptoms may be considered unquestionable. Part of the development phase, or the result of another condition. For example, parents may think that eye blinking are related to vision problems, or sniffing is related to seasonal allergies. Many patients are self-diagnosed after their parents, other relatives, or friends may read or hear about TS from others. Okay, now this is a long one, so how is TS treated is a long one, so, and then I'm going to read this, which is going to be last. So prepare for a long thing. Oh, I don't want that. Okay. How is TS treated? Because tic systems often do not cause impairment, or majority of people with TS require no medication for tic suppression. However, effective medications are available for those whose symptoms interfere with functioning. Norepinephrine drugs may be used to that may be used to treat physistic and non-physistic disorders. The most useful medications for tic suppressant are a number are available. Some more efficient than others. For example, haloperidol or promazone. Unfortunately, there are no one medication that is helpful for all people with TS, nor does any medication completely eliminate the symptoms. In addition, all medications have side effects. Many low pittance side effects can be managed by annihilating treatment slowly to reduce the dose when side effects occur. Most common side effects are oh my gosh, well, I can't read this word. Okay. Neuroleptics include sedation, weight gain, cognitive dulling, neurological side effects such as tremor, dysnotic reactions, twisting movements, or postures. Parkinson-like symptoms and other dyspneic involuntary movements are least common and readily managed with dose reduction. Why was that so hard to read? Oh my gosh. Oh, reading so hard. Okay. Sorry, guys. Discontinuing neuroleptics. Oh my gosh, seriously? After long-term use must be done slowly to avoid rebound increases in tics and withdrawal dyskias. One form of dyskineas called tardive dyskinesia. Okay, I can't say this word. Is a movement disorder distinct from TS, may result in chronic use of neuroleptics. The risk of the side effects can be reduced by using lower doses with neuroleptics for shorter periods of time. Other medications may also be useful for reducing tic severity, but most have not been extensively studied or shown to be consistently useful as neuroleptics. Additional medications may demonstrated efficiency include alpha-androgenetic agonists such as clonidine and guanfacine. These medications used primarily for hypertension, but can also be used for treatments of tics. The most common side effects for these medications are petechial and sedation. However, given the lower side effect risks associated with these medications are often used as first-line agents before proceeding treatments for neuroleptics. Effective medications are also available to treat some associated with neurobehavioral disorders, such as patients with TS. Recent research shows that stimulation medications such as methylphenidate and dextromethorphan can lessen ADHD symptoms. Oh my gosh, my eye. When people with TS can, without causing tics, can become more severe. However, the product labeling for stimulation currently contradicts the use of these drugs in children with tics/TS. And those with a family history of tics. Scientists hope future studies will include those through a discussion of risk and benefits seamless those with TS or family history of TS will clarify this issue. For obsessive compulsive symptoms that significantly disrupt the daily functioning of serotonin, mutic inhibitors, clomiphene, fluoxetine, fluvoxamine, paroxetine, and serotonin can be proven effective for some patients. I can't speak. Okay. Behavioral treatments such as awareness training and competing response training can also be used to reduce tics. In recent NIH-founded, multi-centered randomized controlled trial and called cognitive behavioral intervention for tics, or CBIT, showed in training to voluntary move in response to primatory urge can reduce tic symptoms. Otherwise, behavioral therapy such as biofeedback or supportive therapy have not been shown to reduce tic symptoms. However, supportive therapy can help a person with TS become better to cope with their disorders, to deal with the sanitary, social, and emotional problems that sometimes occur. That's all I'm going to read today, but to clear that up is basically what can help it. So, like the medication, the treatment you can do if you don't want to take the medication, all that. So, please like and subscribe if you want to see this next part. And I think I'm going to do one last part. I'm not sure though. But yeah, please like and subscribe and comment. Yeah, bye. Mwah.